They know that it works for their business. They know that it works for their social media following. So I think it's just a line that they say that they don't understand why it's so bad.
You know, having worked in the beauty industry, I understand how the beauty industry works. I completely understand that there is a drive to create insecurity, particularly in women of all ages. And I feel as though the cosmetic industry has just seized upon that marketing. When did our medical doctors, when did our medical professionals become about marketing and sales?
This program's content is provided solely for informational purposes and should not be construed as medical, legal, or financial advice. Views expressed are opinions only. Our discussions are general and not focused on specific companies or individuals unless explicitly mentioned. We strongly recommend consulting a qualified medical professional before contemplating any major or minor medical procedures. Be advised that some content discussed may be distressing. Discretion is advised. The hosts of this program believe all people should be able to access cosmetic surgery procedures free from judgment. Welcome to Surgery Secrets, Beauty's Dark Side. I'm Madison Johnstone and I'm co-hosting this podcast with Michael Fraser. If this is the first time you're tuning in, this podcast explores the dark side of the cosmetic surgery and injectables industry. Make sure you follow us on Instagram and TikTok at operation.redress for snippets from today's episode and further content on tips videos when you're thinking about getting cosmetic surgery. One very important topic of discussion when looking at cosmetic surgery is the link between social media, body image, the beauty industry, and then the consideration of getting cosmetic surgery and injectables. There is a whole world out there designed to impact on people's insecurities, and if those insecurities don't exist, to create them. This world is the cosmetic surgery world. It promises to make you beautiful with every cut and every needle. Today, we are lucky enough to have Dr. Vaya Sekas with us to talk about body image, body insecurities, social media, and cosmetic surgery. Thank you for being with us today.
Thank you for having me.
Vaya, would you like to tell us a little bit about your background?
Yes, it's not that of the usual academic. So before I became an academic, I was in the fashion industry for close to about 13 years. And I started off as a house model. So that basically means that samples were made to my measurements, and I would have fittings, and I would go through what the garments felt like on. So it was a kind of a comfort thing, but also, how durable things, the clothing was actually going to be. I then moved from that into a design assistant job, and then I became a co-designer for a company in Sydney. So that was kind of my life for a good 12 years, and it just got to the point really where long hours, I really wanted to change. So I went from the pot into the frying pan and moved into the beauty industry, where I, just worked on the counter really. And from there, I also became a facialist for a very high-end luxury beauty brand. So I have a lot of hands-on experience in both the fashion and beauty industries, and of course, my interest was always going to be body image. And that's how I ended up being a researcher in body image, as well as lecturing psychology at Griffith University.
We know you've done a couple of studies on social media and the beauty industry. Could you please tell us what you were looking at with your research article, which you did with Grace Barker? Does beauty have a dark side? Testing mediating pathways between engagement with beauty content and social media and cosmetic surgery consideration.
Yeah, of course. That actually came about because during my PhD, this is when social media research was really emerging. So I actually looked at a combination of appearance-focused content on social media, and one of them was beauty. So I looked at celebrities and fashion as well. But what I found going back and just looking at some different analysis after my PhD, I actually noticed that beauty was driving the predictor of that particular appearance-focused content onto body dissatisfaction and drive for thinness. So that kind of piqued curiosity in me, and I thought, yeah, this is very interesting, because body image in general, we look at weight and shape-related issues. So I thought, yeah, we don't have that much research in the way of facial features and how we feel about our facial features, how the influence of social media might change the way that we feel about our facial features. So what my honours student and I did, and that was Grace, we looked at beauty content on social media, and we wanted to understand the kind of content that was probably being viewed mostly. So we did a little pilot study, and we asked some women aged between 17 and 25, which are usually the target population. And we found that beauty tutorials are being viewed a lot. We found that beauty influencers are promoting a lot of products. We also found that there was these kind of journeys that girls were taking, these sort of what they call baby botox journeys, which I thought, oh, that's new. That's something I've not heard of before. So we had a little look at that and realized what that was. So we compiled some questions and put them into a large questionnaire, and then we had close to 400 girls complete that questionnaire. And what we found was that the more that they viewed this kind of content, and when we look at this kind of content, we're looking at girls who represent a very idealized face shape and facial features. So we're talking about facial symmetry, perfect petite noses, high cheekbones, full lips, cat-like eyes. So these are features that often we don't see in everyday sort of faces. So what we found was that the more that they viewed this kind of content, the more likely they would compare themselves to that content. The more they'd compare themselves to that content, the more likely they would be to feel anxious. So anxiety is part of that dysmorphic appearance concern, and that's what we measured. And then if they had more of that, then they'd be more likely to consider having cosmetic surgery in the future.
Did they already have to have that existing body dissatisfaction to start considering cosmetic surgery, or was it that social media played such an imperative role in that desire or consideration?
Basically, if you were considering cosmetic surgery, it didn't necessarily mean that you would be going and watching beauty content, nor would it mean that you had dysmorphic appearance concerns, nor would it mean that you had the desire to compare yourself with others. So, and essentially what we're saying is that, but we would need longitudinal research to show this, but this modelling is suggesting that the more people view this content, the more likely they are to compare themselves to it, the more likely they are to then report having those higher dysmorphic appearance concerns, and the more likely they are to consider cosmetic surgery.
It's really a fascinating topic that has been explored, and it's something that we've been looking at ourselves. We've both sort of gone through this journey too, where the more you look at, the more you start to question the way you look and whether you need to fix things because that's how it's advertised. So I think your research was extremely important.
Thank you, Madison. Thank you.
What is baby Botox, and what did your research uncover about it?
So I must preface this with, I am not a cosmetic or plastic surgeon, but my understanding of baby Botox is that it is the same strength of traditional Botox, but it's just administered in much lower doses. So it is targeting more, let's call them fine lines, and it's more for that kind of smoothing the skin out. So it's being promoted more as a preventative measure, whereas traditional Botox is more of a treatment measure. And that's my understanding of baby Botox. So whilst it is a lower dosage, it would need to be administered more regularly. So when it comes to cost, yes, it is a little bit cheaper, but then when you're looking at having those more regular doses, it probably is the same as having regular or traditional Botox.
One thing that we have been hearing a lot of speaking to younger people, younger women that are 18 plus, is they almost are like fearful of this age creeping up on them. It's a new thing that we've noticed where thinking I've got to do something about my aging or I'm going to look terrible. And it's really concerning that the social media seems to be driving that. Do you want to have a think about that?
Yeah. I do actually think that it is unfortunately a sad truth that this type of content is in the palm of young girls' hands 24/7. This isn't like when we used to get a magazine once a month, and I was one of those people. I would run down to the newsagent and get my monthly fix. I might look at that magazine a few times through the week, and that would be the end of it. We're now talking about a situation where young girls who are seeking their identity, trying to establish it at that vulnerable stage in their lives where they're seeking relationships, new jobs, university, all different kinds of things in their lives. And I feel as though the content that comes up on these sorts of, let's say, TikTok, Instagram, the more highly visual apps, it really taps into young girls' insecurities. And one of the insecurities is, unless you're youthful, there are no rewards. And so that puts a lot of fear into young people. And so they start to think, okay, what can I do now? Because I don't want to get to 40 and look 40, heaven forbid. So unfortunately, this whole idea of holding on to one's youth is no longer just for mature age women. This has now become a problem, so-called problem, for young girls who have absolutely nothing to worry about. All I can say about it is that when you see it 24/7, it becomes normalized. And so you don't think that you're doing anything abnormal by having baby Botox, for example. That's just where I may have had in my 20s, I may have had some anti-aging moisturizer. Having baby Botox now just seems to be the next generational thing. So for me to maintain my youth, I have to have this baby Botox. And it is sold like that. It is sold almost like this is just your daily skincare routine.
Using the magazine analogy, if you wanted to show your friend something, you might cut it out or lend them the magazine or even just talk to them about it. But now with social media, you tag your friend in it, you direct message them it, and then the algorithms jump into play here. And it's not just one article they've read or one image they've viewed, they're now being inundated with it 24/7. Is that something that is concerning to you?
It is concerning because the research is telling us this is problematic. So this isn't just anecdotal conversations anymore. We now have, close to 10 years of research really within the social media and body image space. And we do understand that even brief exposure to people who might not normally watch this content are still affected by it. So imagine what it must be like when you're exposed to this all day, every day. We know that on average, young women in particular are likely to view about 3.5 to 4 hours of this sort of content a day. That's a lot of consumption. It would be virtually impossible, I think, not to be affected by it. The issue is, though, that not everybody is affected to the same degree. And I think that's an important thing to discuss. Some people are able to view this type of content and be okay with themselves. They don't necessarily see a discrepancy between themselves and the person they're viewing. They just kind of think, oh, that's a good tip, and leave it at that. Unfortunately, though, as I mentioned before, this is a really crucial developmental stage where they're moving from adolescence to young adulthood. And for many women, and when I say many, we are talking about the majority, they will experience some level of anxiety about how they look in comparison to the images that they're viewing. So it would be completely unfair to say that social media is not having an influence, but it has a slightly different impact on people because of what they bring to the table.
Your research also looked at body dysmorphia, which is known as BDD, and that BDD patients experience dissatisfaction post-cosmetic surgery. There has been a lot of discussion recently about BDD in the cosmetic, injectables and surgery industry. Can you explain what it is and what your research found out?
Yeah, of course. Body dysmorphic disorder is actually a mental health condition, and it is diagnosed specifically usually among young people, or at least that's where it's most prevalent. And it is when a person is feeling overly anxious about a specific feature on their body. Usually it's a feature that's on their face, but occasionally it can be a feature on their body. And this anxiety leads them to check that feature on a daily basis. And when I say daily basis, I'm talking about hours throughout that day. It also leads them to camouflaging behaviors. So whether that is using excessive makeup or using clothing to try and camouflage the perceived flaw. So we can see that it is the type of disorder that affects someone on a daily basis, but affects their life. So it can take hours before this person is actually ready to go somewhere. So we can see that it's not just having a slight anxiety. It is actually a mental health disorder. What my research looked at was dysmorphic appearance concerns. And these are, let's call them subclinical symptoms. So these are the symptoms that someone might experience at a lower level. So they may not have it on a daily basis, but they may have it a few times a week, and they can feel that it's creeping up a little bit more. So it's more, we wanted to look at body dysmorphic concerns because we wanted to find out how early these symptoms were coming up. So before we hit diagnosis stage. And sadly, we found that we had far more than we thought we would that were experiencing high levels of body dysmorphic concerns.
Do you think the beauty content on social media is making body dysmorphia or these concerns stronger, or are they creating them?
I think for somebody who is already experiencing some level of anxiety about their, whether it's their facial features or body, watching or being exposed to that kind of content is just going to highlight it more. So we have one group of people who might already experience levels of anxiety, but we also have another group of people who may not have experienced anything, but just being constantly exposed to it, then we can see that these effects become more so after exposure. It's kind of a double-pronged and very complex issue. It's not just as simple as social media is causing all of these things. There are, of course, other contributing factors. But for the most part, being exposed to this type of content is going to lead young people to think that there's a discrepancy between themselves and what they're viewing. Because quite often they're viewing someone who is idealized, whether that's through editing, filters, etc. They are idealized. And so that discrepancy becomes so much more predominant by looking at these videos. If they didn't have access to this, there'd be less likelihood of this highlighting of their own features. So the comparisons, these are what really drive the dysmorphic appearance concerns when people are looking at beauty content. And we actually found that upward appearance comparisons was the mechanism that really, whilst there was a connection between viewing beauty content and dysmorphic appearance concerns, the process of comparing oneself to those people that they deemed more attractive was the driving force.
Do you think filters are causing people to want to get cosmetic injectables and surgery?
Again, another complex issue, but in my line of work, quite often I have to go into TikTok and Instagram, unwillingly, I might add, because I know how insidious these apps can be when it comes to this type of content. I wanted to go in and try out the new Bold Glamour filter on TikTok. And, when I tried it, I thought, oh my God, I actually look like J-Lo. How could I not think that that's amazing? How could I not want to maybe try and look like that on a daily basis? Thankfully, it's me and I'm way past that. But let's think about someone who is more vulnerable and puts on a filter like this and thinks, well, I want smooth skin like that. I want a nose like that. I want high cheekbones like that. The only way that they can achieve that, because this isn't a diet and exercise thing, the only way they can achieve that is through fillers, Botox.
Can fillers and surgery actually even address making you look like like the filter?
That's a really good point. And this is where the dysmorphic appearance concerns come in. Quite often we look at a filtered image of ourselves and most of us are okay with it and we just look at it and move on. But we're talking about that group of people, that percentage of people for whom that is not okay, where they think, no, I really don't like the way I look without that filter on. So they would be likely to go to an injectable facility and say, I would like to have this sort of feature. And I think that it is the responsibility of the person administering these injectables that needs to say, okay, what you're seeing on this filtered image is actually not what an injectable can do for you. It is not going to give you poreless, flawless skin. It isn't going to make your cheekbones stand out to these, these heights. And it's not going to make your lips look large without them looking like they've been injected. And I think these conversations really need to be had between the injector and the person going in, particularly when they're taking in a filtered image of themselves and saying, hey, can you please do something so that I can look more like this?
We have heard that a certain percentage of nurses or practitioners offering procedures have body dysmorphic disorder. Do you think that could be problematic, that someone with BDD is then treating people who may also have BDD or don't even have BDD?
I've not actually heard of this myself, so this is the first time I'm hearing it, and it does, it raises alarm bells for me, definitely, because somebody who is diagnosed with BDD is not going to have those boundaries as such. It's also likely that they may advise somebody incorrectly, just based on their own idea about injectables. That's not to say, and this distinction does need to be made, that's not to say that someone with a mental health condition cannot be a counselor, cannot do a job and do it well. But we're talking about a very, very specific diagnosis that is tied up in appearance. And appearance is just, it's such a subjective thing.
If you are a practitioner that has BDD, there may be a chance that working in that job is what created the situation that you have. So I wonder what percentage, it'd be interesting to do research to see what percentage of health practitioners formed body dysmorphic disorder because they're fixating on this stuff all day at work.
I think when we have access to so much, and not only access to the product and the treatment, but also access to different people using it, promoting it, then it adds another layer of how it might influence the way that you feel about yourself.
Is it obvious to identify a digitally altered woman compared to an unedited woman online?
I think a few years ago, possibly. So there were certainly glitches that people could see in edited images. But boy, oh boy, I think that's changed a lot. I think AI just generally has progressed so much. And part of that is the editing and the filtering tools that are available on these apps. It's interesting when we talk about editing or edited pictures and filtered images, whether it's on video or two-dimensional pictures. I was doing just a workshop not too long ago, and some of the things that we were talking about with girls aged 17 to 25 were these edited pictures. And what was very obvious to me through that conversation was that they all knew that images are edited to some degree. They feel that there would be less than 1% of images out there that don't have some level of editing. So there They were talking about it in very normalized terms, that's okay. We just realize it's filtered and just move on. So unfortunately, because it has become so normalized, whether they realize that something's edited or not makes very little difference. And in fact, there has been some research by one of the most renowned researchers in body image, Marika Tigerman, Professor Tigerman, and she actually did quite a few years ago now, but she was looking at it in magazines. And so she had some images from magazines that were edited and then had a disclaimer that these pictures are edited, and then had another one with no disclaimer. Made absolutely no difference to the participant's body image. So I think that going back to that 24/7 exposure, whether or not something's edited, I don't think it has much effect on them. And I think, as I said, to some degree, they just think everything's edited. And if it's not, then they just look at it as a bonus that something's natural.
That's actually really interesting to us, because one of the main things that has come out of the big cosmetic surgery review that happened in Australia was that doctors can no longer publish selfie images or lifestyle images, so patients in bikinis at the beach, to sell or advertise cosmetic surgery. And one of our big problems, they don't understand, by the way, the doctors don't understand why that's such a big problem. One of the issues we had with that is that a prospective patient cannot tell whether that photo that that patient sent in has been edited. So they think that they're looking at the surgery in real life, when really they could be looking at an edited photo. But you're saying that that might not actually play a big role in that patient looking at surgery?
It might not play a role, but that actually is dangerous, because if they are looking at an edited image, which is very likely that they are, then their expectations of potential surgery that they might be considering, how their expectations are going to be let down. And so the image itself is misleading. And it is shocking and upsetting to me that doctors can't understand that an image can have that much effect on someone, particularly when we have decades of research about the influence of exposure to particularly idealized imagery. So it sounds to me a little bit like it's more to do with ruining their prospects of self-promotion than it is about the causes of those images and the kinds of consequences that they might have on people viewing them.
We think they do know. They say they don't understand why these images are so bad, but they know that it works for their business. They know that it works for their social media following. So I think it's just a line that they say that they don't understand why it's so bad. I think that, as you said, there's so much research out there. And if they actually looked at the arguments being made through the submissions processes that happen with the regulator, that they would understand. If they wanted to, they would. But it seems strange that they don't want to. And it's probably because it helps their business.
I would completely agree with that. And, you know, having worked in the beauty industry, I understand how the beauty industry works. I completely understand that there is a drive to create insecurity, particularly in women of all ages. And I feel as though the cosmetic industry has just seized upon that marketing and just using it themselves. And I think what's really disturbing is that they are medical practitioners. So when we're talking about the beauty industry, we're talking about companies, we're talking about marketing and sales. When did our medical doctors, when did our medical professionals become about marketing and sales? I have yet to walk by a bus. I have yet to walk by any billboard where I have seen the promotion of so-called unedited images of women who have had certain procedures. I have no idea how they can walk, how they can hold their head up high and with a straight face say, this picture, this image has not been edited, or I'm not aware of it being edited. It's your company that this particular advertisement is promoting. So why would you not know what's being edited and what's not in that image?
There seems to be a really big push to just get lots and lots of content out there, and most of it's done on mobile phones. So mobile phones themselves actually do a fair bit of post-production on the photos and videos, if you will, brighten up the colors, skin textures, change things around automatically. So already that sort of, once it's done on a phone, changes almost the meaning of the message. But when you look at clinics, they seem so obsessed with putting information out about anything that might create sales. Very little information about risks. And if there is information about the risks of these procedures, they often dismiss it by sort of saying like, but we're really good here. I've heard cosmetic doctors say, oh, I don't think I've ever had a complication with that procedure. We have a pretty good rate here. They're not allowed to speak like that. But what seems to be a really big theme is they're now turning these medical clinics into like a day spa. They look like a day spa. The filming that they're doing inside, they're getting film crews in there to create cinematic videos of people getting procedures. And I think they're confusing beauty and medicine. So people don't feel like, because they go there for a facial and they get injectables. What do you think about that? I don't think beauty and medicine should be merged together in the one business like that.
That's an excellent point. And I myself have been noticing this blend of beauty, which we've always known is it's just marketing. We know that, and most people know that. But we often think, oh, buying a moisturizer, it just makes me feel a bit better. That's fine. We sort of know that buying even an expensive moisturizer is probably not going to change the way we look. I think we've all understood that over the years. But in comes the injectables. So now it's this blend of wellness and, you look less stressed and, everybody works so hard now and we're all working long hours. Like having these injectables are just such a good way of your face showing that, your work life isn't getting to you, that you are relaxed. And so it's blending it in with what we've always known to be fairly harmless, which is the beauty industry. And I think you're absolutely right, Michael, in terms of this cinematic experience. And unfortunately, when we are blending medical treatments in with beauty treatments or wellness treatments, it can be very confusing for the consumer. And it can be difficult to pull apart what is just a marketing thing and what might actually have dire consequences. As I said before, a moisturizer is not going to make our eyebrow droop or cause some paralysis. But having botox injected into the wrong part of our face can cause those things to happen. Now, yes, a doctor might say they're temporary. Sure, they're temporary. But what about the mental health of that person? They're going to be embarrassed to go anywhere. So they're going to start isolating themselves from people. They're not going to experience the social interactions they have before. So there are lots of knock-on effects. It isn't just, something might go wrong, but that's okay. It might only be temporary. There are lots of things that happen to a person and that a person experiences because of something that has gone wrong, particularly on their face, where they know that everybody is going to see it and other people will judge them. I think the consumer has every right to be fully informed. And that includes being educated, particularly when someone is about to become or administer something that's invasive, whether it's a cut to the skin, whether it's a needle to the skin.
Do you think that consent process starts with the advertising? Because some doctors say, well, I tell my patients about the risks in the consult, but we look on their advertising and it's glamorizing cosmetic surgery and injectables, but also minimizing the risks. So they don't even sometimes even mention that there are any risks. So do you think that consent process, as somebody who lectures in psychology, starts with the advertising?
Oh, advertisers know exactly what they're doing. And some of the advertising is subliminal, but when it comes to cosmetic procedures, they're as clear as the sky. And it is so clear to me that images that are idealized have an influence on how someone perceives that a procedure is going to result on them. So if they're seeing an image of a woman with all of the things that they would like to see on themselves, then they're going in with an image in mind. And the risks, which are usually tiny, tiny little bits of writing somewhere, is something that looks quite unimportant to the person whose main goal is to go into a practice and come out looking like their ideal image. In terms of marketing, and we were talking about lecturing in psychology before, and some of the things that we do discuss in psychology are the marketing tactics. And one of the main ones is this idea that if we show more of something, then that's going to have the effect. So if we show that last and we talk about the risks first, then the person is more likely to have the recency effect, and they're going to think about what they just saw. So if you go in for a consult and the doctor does sit down and immediately go through some of the risks with you, but then finishes on, this is, we're going to have these great results, this is what's going to look like. Those primary things that they were discussing before, they're long gone. That consumer is no longer thinking about the risks that this procedure could entail. They're just thinking about the outcome. They're thinking about how I'm going to look when this is all done. And that's fine. I'm already aware. I've already controlled in my mind for pain. So I understand there's going to be pain. I understand there's going to be a bit of swelling. All fine. And, many times they see these so-called journeys on social media. So again, they've normalized the idea that they're going to go through some type of pain, but they're going to have the outcome that they're hoping for, which we know is not always the case.
You've spoken about the thin ideal in your research as well. Can you explain what that is and also what that might mean in terms of trend-based surgeries like the Brazilian butt lift?
For decades now, we've been talking about the thin ideal. It's a pretty simple term, but generally when we think of the thin ideal, we think of a Barbie physique. So we think of a physique that is lean, that has perfect bust to waist to hip ratio, has long legs, everything's symmetrical. So we're talking about really an unrealistic, unattainable body. And sure, I understand that there are going to be a very small percentage of models who probably have all of those attributes, but we also need to understand a lot of that's biology. So those sort of features don't come naturally to the majority of people. So we call it the thin ideal because it is idealized. And in most instances, a person will have to go through extreme dieting, disordered eating. And lately, we've also been, people have access to all kinds of cosmetic treatment as well. So whether it's liposuction or tummy tucks, those kinds of things are also part of subscribing to that lean, thin ideal. So that's what we mean when we talk about the thin ideal. We talk about it in terms of ideal because it is often unattainable by means other than cosmetic surgery and extreme dieting.
We've lately seen, and we think that this trend is now actually leaving, but we saw the emergence of the Brazilian butt lift, and that kind of goes against the thin ideal. How does that match up?
We know that the fashion industry goes through cycles. And we also, for the first time, 10 years ago, we had the rise of the influencer. This is something we probably didn't see before. So people like the Kardashians, who not only have a huge social media presence, but they also have their own show. All of a sudden, they were showing young girls that you didn't have to have this thin ideal anymore, that you could be curvy, that you could have a different body shape, and still be very, very much accepted by society. Unfortunately, once again, having a butt that is very not in proportion with the rest of the body, so very exaggerated, is again not something that can happen naturally. So a lot of people would have to go and have some kind of, whether it's an implant or whether it's injectables, to soften that area and have that more exaggerated look. All of that said, I think that trend was definitely happening a lot over the last 5 to 6 years. I do think, though, that we're probably going to see a U-turn. And that, again, has a lot to do with the Kardashians. So they have now lost weight. They're looking at a slightly different body shape that is having a knock-on effect on their followers and the people that are exposed to their TV shows. Like anything in the fashion world, it has its cycles. My fear is that we're going to go back to that size zero trend, fad, call it what you like, that we saw in the early 2000s. So everything comes with its consequences, unfortunately. But that's what the fashion industry relies on. It relies on selling things. So unfortunately, young people are often the consumers and the ones that are likely to become vulnerable.
On the Brazilian butt lifts, so let's say talk about like a 24-year-old young woman sees this trend, goes and spends $20,000 to $25,000 getting a Brazilian butt lift, right? And the way it's done when it's with fat is essentially they liposuction it from all different parts of your body under your skin, creating scar tissue everywhere to harvest the fat and inject it into your butt, dramatically changing the size depending on how much fat goes in. What happens? So you've obviously been trend motivated, or let's say you have been, then that trend changes. You're still paying off the loan for your butt, but it's not like they can just come and let some of the fat out like it's an over pumped up tire. You're now going to have skin that is stretched and can't fully retract. So that might require a significant surgery that could even cost more than the original. Now the trend has changed and you are influenced by trend. What could that do to your mental health?
Your mental health can very, very quickly deteriorate. And that's the unfortunate part. These are the long-term effects that we don't often think about. And these are the discussions that a lot of practitioners don't have with their clients. They don't think about the long term. They just think about the immediate. You're going to look great. This is what you want. I'm going to give it to you. You are now going to have a happier life. But we all know that those things are really quite temporary. So in terms of scar tissue, I had surgery about 15 years ago, and I still have scar tissue that's floating around in my pelvis. That is causing me unbelievable pain during certain times of the year. And that is something that I didn't want. So imagine how someone might feel about themselves and the decisions they're making when they decided to go and have something injected or implanted into a body part, and it's now causing problems for them because they know that it's no longer something that represents them. It's no longer part of their identity. So that level of mental health is, as I said, it's something that people don't think about. They will become isolated. They will start to think that they no longer fit in. And when I think about this, I often think about breast implants because a lot of people think, oh, yeah, I'm over that now. I don't want it now. It's much easier, I think, to remove breast implants. But when we think about our butts, they are there for a reason and they help us sit. I cannot imagine not being able to sit comfortably. That has got to be, so not only is it a mental health problem, but imagine the physical discomfort that would give someone on a daily basis. So I really have no words in terms of the trends and the irresponsibility of the practitioners who feed into these trends and don't give their consumer every bit of detail to think about.
We've heard, or we've observed even, doctors avoiding the word pain. They prefer the word discomfort. So they try not to use the word pain at all in their advertising or even in their consults. What is the psychology around that?
That's really good. And immediately I have, there's a bit of research that springs to mind. It's pretty old research, but I think it's something that's worth talking about. And a researcher had a sample of people who put their hand into an ice bucket and had another group of people who also did the same, but they gave them a placebo aspirin that they said, oh, taking this is actually going to make this feel so much better. Of course, it was exactly the same temperature of ice, but because they were told that this wasn't going to hurt as much, they were able to leave their hand in the ice bucket for much longer. So there is something definitely with the wording that we use, the language that we use. The more that we use words like discomfort and avoid the word pain, the more likely the consumer is going to buy that. And even if they're feeling excruciating pain, it's just uncomfortable. So if you were asked them to explain the level of pain, it's really uncomfortable. They will almost be mirroring the same language that the practitioner used because it also eases them. It eases their level of pain. And when it comes to cosmetic surgery, they're also thinking about the outcome. Whereas normal surgery, you just want to get better. This has an aesthetic result. So they're willing to endure the pain or discomfort, if you will, because they know that they're going to have something great at the end of it, or they feel they're going to have something great at the end of it.
Someone from the industry who had a bit of a whinge to us about the fact that we lobbied hard to get the advertising laws changed said, if you put all the risks in the advertising, people won't get surgery. And they were really bothered by that because it would impact sales. And I just thought, how telling is that? And when you actually look at the social media, when you look at the advertising, and maybe when you go away after today and have a look if you haven't noticed, even when there are risk statements in there, because they're now required to put sort of the risks in their posts with cosmetic surgery, they do a ton of spaces to push it way, way down to the bottom of the message so you almost don't even accidentally see it if you're reading the post, which kind of is almost worse than not putting it in, because it's a deliberate thing to make sure you don't see it.
And unfortunately, that just goes back to some of the research I was talking about where they did put a disclaimer up for edited pictures and one without. Doesn't make any difference. So what it seems is happening is that cognitively we are just drawn to the very thing that is going to make us feel better. It's just human behavior. When we look at a risk, that's almost interfering with what we want to achieve. And we want to overlook anything that's going to do that. So practitioners know full well that a person is going to think that way. So even if they're forced to put it on, even if they put it on in larger letters, I honestly don't think it would have that much of an impact. Where the impact is more likely to happen is the conversation that the person has when they go in to have a consult. That's really where responsibility needs to come into place.
Overall, with this research that you've done on the beauty industry, beauty content, social media, and cosmetic surgery, what is the message that this should send to those that are regulating the cosmetic surgery space?
I think in terms of the experimental research that I've conducted, and I think that's actually quite important because we exposed 7 minutes of content to participants. And these were, again, women aged 17 to 25. And the reason that we target this age group is because we know, A, they're the most vulnerable, but B, they're also the most likely to be persuaded that something will work for them. So we showed a group of young women beauty content that included beauty tutorials, skincare routines, but we also showed them girls having baby Botox journeys. So what that included was girls lifting their eyebrows as hard as they can and showing very little crease in their forehead. But then they would go in, have the injectable, and then they would show that same forehead over time, where they would raise their eyebrows and they'd have less and less and less wrinkles until it's completely blank. We showed them 7 minutes of this content, and in 7 minutes from pre to post test, they had higher anxiety about their appearance. They felt more ashamed about their appearance. They showed themselves less self-compassion, so less ability to self-care. And they were far more likely to engage in appearance processes. So when we think about those 3 factors, anxiety, shame, and comparison processes, they are all symptoms of dysmorphic appearance concerns. If only 7 minutes of exposure can lead to elevated levels of anxiety, shame, and comparison processes, imagine what it does to girls who are viewing this constantly. So I think there is a lot to be said for the type of influence that is out there on social media. Whilst this is only one study, we are now seeing more and more studies come forward. So, for example, we did cite a study that did look at images. So we looked at videos on TikTok and they looked at images, and they had images of cosmetically enhanced women. And they also showed that there was far greater consideration for cosmetic surgery after they viewed the images than there was before. So it is virtually impossible to say that this level of exposure is not having an influence, particularly on young people.
Do you think the regulator should ban advertising in cosmetic surgery?
Absolutely. Absolutely. I remember when I first came back to Australia after living in the UK for quite a while, and I was working in a large retail store, and I went and visited the bathrooms in the main shopping centre, and I could not believe the life-size door. So the whole cubicle door was covered in a woman's face or a woman's body that looked completely flawless from every angle. Now, that was specifically put there where women are walking in, usually in the most vulnerable state they can be in. There's the harshest lighting you can imagine. So all of a sudden, they are confronted with perfection, and then they go afterwards, wash their hands and look at themselves in the mirror. Who thought that was a good idea? I mean, at what point did someone think, this is excellent, let's go and put these perfect images on the cubicle doors so that women can walk in and see what they should be looking like?
Was that cosmetic surgery advertising, was it?
Yes, it was.
Whenever we hear regulators talk in Australia in the health sector, they say their primary duty is to protect the public. The medical sector should be sort of science and evidence-based, and now there seems to be a lot of science and studies and evidence showing that social media is harmful. Now, because it doesn't necessarily demonstrate someone was botched, so someone can have mental health issue as a result of this advertising, or can be exacerbated, but it's not able to be seen by anyone necessarily. Do you think that is a kind of harm that they should be protecting the public from? Like, what could they do? Let's assume they don't get rid of advertising, because I don't think they will. What is the runner-up prize? What should they do to protect the public from these new harms that science is now showing exist?
One of the things that I feel very strongly about advocating for are being able to rejig or manipulate the algorithms on social media. If someone is spending too long on some of this content, then that algorithm should be able to pick that up and send them through their feed neutral content, so it's not appearance related. We already know that travel content and art content, things like that, are very useful in being able to de-escalate any feelings of anxiety that somebody might be experiencing. And just recently, I've been looking at body neutrality content. So that has a less of an emphasis on one's appearance being part of their self-worth and more about what their body can do for them. So there is content out there that I think these big apps, these big companies really need to be taking more notice of. There are people on social media who are trying to do the right thing, but their little video and their product doesn't get seen as much because we know that negativity is what sells. So, and when I say negativity, I'm talking about the things that are going to tap into people's vulnerabilities. That's what they want. Could we get rid of advertising? Absolutely not. In a realistic world. In a utopian world, yes. But in a realistic world, we're never going to be able to get rid of it. But I do think that there are ways that we can try and help people navigate things like social media more safely, have a more supportive environment for them. We are also, my colleagues and I have been trialing some different ways to use social media as well. So we've been looking at detoxing completely for 7 days. So just completely coming off it, not having exposure to any of this sort of stuff for 7 days. We had another condition that had a very limited amount of time. So we're talking sort of 10 to 30 minutes a day on it. And then we had another condition where we asked participants to cleanse their social media feed. So they just had to ask themselves a couple of questions. Does the content I'm looking at make me feel bad about myself right now? If the answer is yes, delete. So it was that kind of process. And so they were cleansing their feed from any content that was actually triggering some negativity. Now, we've only got preliminary results. We're still collecting data on this. But we have seen that each of those conditions, whether someone comes off it completely, whether they minimize the amount of time they're on it, or whether they cleanse their feed, we're actually seeing less body dissatisfaction, less self-objectification, and less pressure from the media. So we know that having that connection to our social media, it's like another appendage, it's like another limb for us. Having some distance from it is a healthy thing. And if people can at least do that, then it might reduce some of the pent-up anxiety that occurs when they're constantly exposed to that type of content, whether it's advertising or just people talking about procedures that they've had.
So you think that would better protect their mental health and maybe protect them against cosmetic surgery advertising?
I think it has to do with less exposure. The less people are exposed to these things, the less they're going to think about them. They certainly won't be at the forefront of their mind. The more they'll be engaged in other things. So unfortunately, the more that we look at this stuff, the more space it takes up in our brain and the more we think that we might need it, that it's something that we could benefit from.
You've spoken about the body neutrality movement. How does that differ from the body positivity movement?
Body positivity is something that women talk about inclusivity. So it's about including all body shapes and sizes. But it isn't just an inclusion, it's having this kind of unconditional love, respect, acceptance of all body shapes and sizes, skin color, ethnicity, hair texture, everything. So what it's doing is moving away from that very narrow ideal I spoke about before, that thin ideal, and it's broadening the conceptualization of beauty, which I think is a really great thing. Unfortunately, the body positivity movement has been hijacked by people who do tend to conform with that thin ideal. And so it's also made some people feel a little bit uneasy about the idea of self-acceptance no matter what. It's like that is a challenge for many people. And then when they see girls who already conform to an idealized or at least close to an idealized standard, they think, well, how can I possibly be like you? I can't be like you. I'm different. I need to see more women like myself. And they are there, but not everyone has the capacity to love themselves unconditionally. So body neutrality differs from body positivity in that it understands that the way that we feel about our bodies, the way that we experience our bodies is fluent. It's not something that we just put into a pigeonhole and we know that that's going to be like that forever. You can't bottle it up. And so it adjusts to those feelings that we have about our body, whether they're good or bad. But the difference is that there is no unconditional positivity towards our body, but there's also no unconditional negativity towards our body. So we talk about the functionality of our body. What can our body do? How does it express itself? How do we heal when we're ill? How do we move? How do we get around? How do we rejuvenate ourselves? So our bodies do a lot more for us than just present who we are. And so the body neutrality movement is really about understanding that our self-worth is far more than what we look like. It's not saying that attractiveness isn't part of who we are. Of course, we all have this idea of presenting ourselves a certain way to the world. That is part of our identity. But what it's saying is that we shouldn't have an attitude towards that either way. It is part of our makeup, but that there's so much else about us that makes us who we are, and they're the things that we should be focusing on.
It's interesting that you mentioned that body positivity movement got hijacked, because we have found it be hijacked by doctors in the cosmetic surgery and injectables industry. Hashtag body positivity, hashtag female empowerment, hashtag love yourself. Cosmetic surgery is being seen as a tool of empowering yourself and being positive about your body and loving the skin you're in, even though it's changing that. Do you have any thoughts on that?
Yeah, I think I do. Unfortunately, as you mentioned, body positivity or that movement has been commodified. And that's one thing they can't do with body neutrality, because there is no positive or negative. So they can't tap into those things that women feel either passionate about or vulnerable to. I feel very sick when I hear that the injectable industry is including body positivity within their hashtags. The reason I feel sick is because when we look at images of people who have had cosmetic alterations, whatever they might be, what we notice is they are actually trying to produce a homogenized look. That is exactly the opposite of body positivity, which, as I talked about before, is this broad conceptualization of beauty. When we look at injectables, that's all about not having any lines on our face. So how do we express ourselves? It's about having the same size lip as everybody else. How does that make us different? What is distinctive about us? It's about having a nose that is perfect. What does that have anything to do with how we smell things? Sorry, I'm actually getting emotional now, because these are the kinds of things that make me angry, but that also push me into doing more and more research and trying to come up with new ways to defeat this. Try and give girls alternatives. And yes, I do talk about girls a lot because they are usually the population of interest that I look at in my research, but they are also the most vulnerable. And for an industry that already makes so much money to be picking up on body positivity, which has been developed and created specifically to move away from everything that is narrow and homogenized, is shameful. It's shameful. It's disgusting. And I urge people who look at those hashtags, think about it. Think about the term positive body image. Think about what it means and how absolutely removed it is from everything that is cosmetic surgery.
I'm right there with you in how angry and frustrated it makes me when I see this content. And it isn't lost on me that it is often male doctors putting out their idea of how the female body should look and how women need to feel positive about how they look, so they should come and get cosmetic surgery with them. That isn't lost on me.
Well, the whole beauty industry is a patriarchal industry. It began with men saying, hey, we can come up with these creams. It's going to make women feel better about themselves. They feel more attractive to men. Everything is geared to men. And then what men do is say, oh no, it's not about us. It's about women being more attractive to themselves or being more attractive to each other. And this whole idea of confounding feminist perspectives with us feeling good about ourselves. There are so many other ways that women can feel good about themselves that does not entail putting an injection into our skin or a scalpel to our body. There are so many different ways. And really, how dare they? How dare they prescribe to us what is positive, what is empowering? What a disgrace.
What I've observed looking at the advertising too is that even when it's female nurses promoting these procedures, it's normally a man at the top. There's normally, it's a male-led clinic. And that man talks about in his story how he's always cared and wanted to grow up and help people. And for some reason, his particular interest in helping people is predominantly women, and it's predominantly an interest in things that men find attractive in women. To me, it seems to be that they're making money out of the insecurities of women. They know full well what they're doing.
I tell you what, if women started to rethink about the types of procedures that they might want to have. So I think I should make it very clear, because it is something that I haven't made clear from the beginning, is that there is no judgment in women and men wanting to have aesthetic procedures, none whatsoever. My concern lies usually with the unnecessary procedures. And when I say unnecessary, for example, having preventative botox, for me, that's an unnecessary procedure. And it's sold to women as some kind of investment. This is an investment for you. I'm sure that if women started to rethink those kinds of investments, there'd be a lot less people wanting to move into cosmetic or plastic surgery. They'd be wanting to move into other areas that make money for them. And this is the unfortunate thing. It's also, there is something about us as human beings that we want to see things that are unusual. So watching cosmetic procedures, for example, so live streamed procedures on TikTok or Instagram or whatever apps it is that plastic surgeons live stream their procedures. That is beyond anything I can comprehend. As a researcher, I don't even think that I would be able to show those kinds of videos in an exposure study. I wouldn't be able to get the ethical clearance. So how these people are able to go onto these social media apps with billions of eyes and just cut into someone's skin or inject them and feel that is absolutely okay, I have zero understanding about that, because it's not even educational. We don't need to know the ins and outs. Do we want to know about how heart surgery is conducted? Some people might, but usually only if you're interested in that. This is something that comes into our feed as normally as, hey, have you seen this latest recipe for this cake? this isn't even something people have to go in and find. It will just come to your feed. That's what's so distressing about all of this. And it really is an insidious industry. It really is. And one of the things that I really hate is when a woman in particular will go in about some procedure. And she feels quite informed about this. She's quite, this is all I want. I'll be happy once I have this because for whatever reason, I'd like it done. And that is her empowerment. She can have that empowerment to do that. But when she walks in, a male surgeon practitioner will say, whilst you're here, you could also be looking at this procedure, or maybe look at, have you thought about this? Or so all of a sudden they're putting things into someone's mind that weren't there before. How is this even legal? How is it ethical? How is it moral? I don't understand the oath that these people take at some point in their career before they go into these industries. How do they sleep at night? I suppose they can buy things that make them sleep at night. I don't know, but it's really sad. Sad and dangerous.
I think there are some surgeons out there that do breast implants and things like that do care. And I think their motivations are very different. And you can often tell who they are because they typically don't really have any presence on social media. And when they talk about educating, they normally educate at seminars and to peers and to medical students. They will talk about things that the public need to know in some videos. They'll talk about things like capsular contracture, where the breast implant essentially has a complication, because people need to know about those things. But they're not doing what most are doing in what I would call dancing for your dollars. I feel like they're all doing a little dance, and they're trying to outdance the other one to get the most attention, because the positive reinforcement is money. It's all about money. There's no other reason you would be there, right? On social media. Why would you be dancing around like an idiot on TikTok? Why would you be, let's bring an unsanitary mobile phone into the operating theatre today, and I'll get the nurse to hang it around all over the sterile instruments and just capture the up close of my patient, who probably doesn't really understand what they've just consented to in this video, or where it's going to be shown or how it's going to be shown. Why are they doing that?
The only reason is money. It's also, I feel as though they're having their moment, and in Andy Warhol's words, everyone will have their 15 minutes of fame. Perhaps there is a little bit of fame that comes into this, and they want to be known. And so they kind of push themselves as these almost rock stars of the cosmetic industry world. And that can be very appealing. A personality goes a long way. And we know even in therapy, for example, it doesn't matter what treatment that you give a client, the success of that treatment largely depends on the relationship between the client and therapist. So if these people have this amazing rock star personality on social media apps, then they're going to attract a lot more people. There's something about them that draws people to them, or that even recommendations. Oh, I saw so-and-so on social media, I'll post it, I'll flip it over to you and you can, see what they're about. And so all of a sudden it's just getting views and views and views. And I think one of the problems with this is that you are selling a personality and you're not selling a medical treatment. Those two things almost seem to kind of move in different directions. And people are buying into the personality and not thinking about any kind of medical risk. As I said, we wouldn't do that if I needed surgery on my kidney. I'd be thinking, oh gosh, do I really need to have this surgery? Maybe I need a second opinion. Maybe. Just like people do who are diagnosed with cancer, they might think, is this the best treatment for me? Maybe I need to go and have a second opinion. Let's find out what else is out there. That often doesn't happen in the cosmetic industry world. Again, because There's no one out there promoting kidney surgery. They're not saying I have lower risks in my surgery than anybody else when it comes to heart surgery. You don't hear that. But when it comes to the cosmetic industry, there seems to be no boundary. There's nothing there that prevents these people from going out and spruiking themselves in this very rock star fashion. So I think that they're having a moment. I think that people are starting to recognize that there might be something else a little bit more sinister behind this so-called fame that they're promoting. But I think we need more people like you to be able to permeate their world and understand more about what goes on behind the scenes that consumers are just never going to be privy to.
It's really important for us that this podcast be a balancing act to all the positivity out there around cosmetic surgery. Now we're going to jump into the final segment.
Vaya, to you, what is the dark side of the cosmetic surgery industry?
The dark side is tapping into people's vulnerabilities, exploiting those for their own business.
A common theme experienced by patients who have been botched. They get told that they deserved it, they got what they asked for, and that cosmetic surgery was an exercise in vanity. What are your thoughts on that?
I think that people seeking cosmetic procedures seek them for all kinds of reasons. And it's very, very simplistic to just say this is a vanity exercise. I completely disagree with the comment. And I think that anyone going in for any type of procedure should have the capacity to complain, to say that something hasn't gone right, to say they've had an adverse reaction, or to say that their expectations have not been met. That is their right as a consumer, and it has nothing to do with this being a vanity project, especially when it's that industry who taps into those vulnerabilities. So it's like gaslighting. Oh, here we are. I have promoted my services. This person has come to me for those services. And if something goes wrong and they come back to complain, I put it back on them. Well, kind of serves you right because, you could have done without that. This is just you being vain.
What are 3 tips you would give to cosmetic surgery providers?
To providers. Have a long talk with your clients way before they've committed to any type of procedure about the risks involved. And I'm not just talking about the potential adverse risks that they can see. I'm talking about the mental health risks that might occur because of an adverse outcome, but also it gives them the opportunity to find out whether there are risks beforehand. Does the person sitting in front of them have any red flags about body dysmorphic concerns, body dysmorphic disorder? Is there something there that this procedure might exacerbate? They really need to understand this part of what they do. Second, please get off social media. You have no business being there promoting yourselves. You want to do it on a personal level, just you, that's fine, but it should have nothing to do with your business. And 3, stop upselling. I have nothing further to say to that. Stop upselling.
What are 3 tips that you would give to patients or potential patients?
Don't let your first port of call for research be social media or even an injectable practitioner. Please go and speak to someone that's in the medical industry who has nothing to do with any of these procedures. Go and speak to your GP. Go and speak to a therapist who actually understands these procedures. And there are quite a few of those around. But speak to someone that you can have a really informative conversation with before you make any decisions about going through with a cosmetic procedure. Second, If something comes through on your social media feed and it's a live streamed procedure, get rid of it, delete it. Click something that states that you no longer want to see that type of content coming through your feed. The less of that gets promoted, the better for everybody. And 3, give yourselves time before you make that decision. Think about all of the things that your body does for you, and then ask yourself, do I need that procedure? If the answer's no, then leave it for a little while. You know, nothing says that you have to go and do something straight away. If it's yes, then go back to my point 1. Make sure that you're well informed about what it is that you want to do. And just know that your self-worth isn't wrapped up in the procedure that you think is going to make things so much better for you.
Thank you so much, Dr. Seekers, for your time and insights today. I think it is an incredibly valuable listen for anybody who's considering cosmetic surgery.
Thank you for having me. I really appreciated this, and you're doing such an amazing job in this very important area.
To our podcast listeners, it is incredibly important that before considering cosmetic surgery that you understand the power of the psychology behind the advertising and really delve deep into why you want to get cosmetic surgery in the first place. As we've heard today, there is no harm in waiting and reconsidering whether it is something you actually want or whether you're being influenced by trends, by marketing, or by your own doctor. Please follow us on Instagram and TikTok at operation.redress for shorts and snippets, and make sure that you send this episode to anybody who you think might be being influenced by Instagram and TikTok cosmetic surgery content.